Have you ever wondered why your wife sometimes experiences complete satisfaction and other times doesn't reach orgasm? Is the problem with performance? Is it timing? Or is there a simple factor that most men overlook, positioning itself? The truth is, recent scientific studies have proven that sexual position plays a significant role in a woman's ability to achieve orgasm. And if you think this topic doesn't concern you as a man, let me tell you that your partner's pleasure is a fundamental part of your own sexual health and self-confidence. Today, we'll discuss this topic with complete medical candor. I'm Dr. Mariana, a urologist with over 12 years of experience helping men over 50 regain their vitality and confidence. I've worked with thousands of men who thought their best days were over, and every time I see how the right knowledge makes a huge difference in their lives and relationships. Before we begin, I have a small favor to ask. Please hit the like button and comment below which country you're watching from. I'd love to connect with men from all over the world who take their health seriously. Here's the truth no one talks about. Many men, especially after the age of 50, notice that intimacy isn't what it used to be. It's not just about erections or potency, but also about their partner's satisfaction, and this directly impacts their self-confidence. The first problem is that most men rely on one or two positions throughout their lives, without understanding the female anatomy that governs pleasure. The second problem is that with age, the body's flexibility and ability to maintain certain positions change, making some positions more difficult. The third problem is that many men feel embarrassed to discuss this topic, even with their doctors. Think of it this way: intimacy is like any skill. The more you understand the scientific basis behind it, the better the performance and the outcome for both partners. That's why today I'll share 4 positions that studies have shown increase the likelihood of a woman reaching orgasm, with a clear medical explanation for each position. The first position, the modified missionary position, or what is medically known as cranial alignment technique. Biologically, this position is a slight modification of the traditional missionary position. The idea is for the man to move slightly upwards, creating direct and continuous contact with the clitoris during penetration. A study published in the Journal of Sexual Medicine found that this simple modification increases the likelihood of a woman reaching orgasm by up to 55% compared to the traditional position. The reason is simple. The clitoris contains over 8,000 nerve endings and is key to female pleasure. Emotionally, this position allows for direct eye contact and complete physical intimacy. This is very important because women often need to feel emotionally secure and connected to reach orgasm. Many men don't realize that the emotional aspect accounts for half of the equation. In practice, the move is simple. Instead of remaining in the traditional position, shift your entire body about 5 centimeters upwards. The goal is for your movement to be more horizontal than vertical, meaning friction rather than deep thrust. Try this modification and you'll notice the difference. One of my patients, Abu Khalid, 56 years old, came to me feeling frustrated, saying, "My wife isn't enjoying herself like she used to, and I feel like I'm letting her down." After I explained this simple adjustment to him, he returned 3 weeks later and said, "Doctor, the difference was amazing. My wife told me she felt a level of pleasure she hasn't experienced in years." The second position, the cowgirl position, where the woman is on top. Biologically, this position gives the woman complete control over the angle, depth, and speed. Its effectiveness stems from the woman's ability to adjust her position to provide direct stimulation to both the clitoris and the anterior pelvic region simultaneously. A 2017 study by Indiana University found that female-controlled positions are associated with higher rates of orgasm. Emotionally, this position gives a woman a sense of strength and empowerment, which positively impacts her self-confidence and the quality of the relationship. For a man over 50, this position is excellent because it reduces physical exertion, allowing him to maintain it for longer periods without fatigue. Practically speaking, the key here is communication. Let her take the lead and tell her you want her to find what's comfortable for her. You can support her by placing your hands on her hips. And an important tip, back and forth movements in this position are more effective than vertical movements for clitoral stimulation. Before moving on to the third position, let me tell you that the fourth position is where most men get it wrong, even though it's one of the most effective. But first, the third position, the side position or the spoon position. Biologically, this position allows for rear penetration while simultaneously stimulating the clitoris, whether by the man or the woman herself. The angle in this position allows for gentle, continuous pressure on the anterior vaginal wall, the most sensitive area. Research published in the Archives of Sexual Behavior confirmed that positions combining penetration and external stimulation increase the chances of achieving orgasm. Emotionally, this position is incredibly intimate. Full physical contact from behind, the ability to whisper and communicate, the feeling of being embraced and safe, all of this creates an ideal emotional environment. In fact, many women over 50 prefer this position specifically because it combines physical comfort with emotional closeness. Practically speaking, lie on your sides with the man behind the woman. Penetration should be gentle and slow. Use your free hand to stimulate the clitoris with light, circular motions. This position is ideal for those with back or joint pain, as it requires minimal physical effort. Another patient, Abu Ahmed, 61, had been suffering from knee pain that kept him from intimacy for months. He told me, "Doctor, I feel like I've lost this part of my life." When I advised him on this position, he returned a month later and said, "For the first time in a long time, my wife and I felt connected again, and the pain wasn't an obstacle." The fourth position, the elevated position or the pillow position. This is the position I promised you, and one that many men get wrong. Biologically speaking, this position is simply the missionary position with one or two pillows placed under the woman's hips. This slight elevation drastically changes the angle of penetration so that there is direct pressure on the anterior vaginal wall and the anterior clitoral area. A study from the University of Texas found that changing the pelvic angle by 15 to 20 degrees can significantly increase internal stimulation. Emotionally, the beauty of this position is that it requires no extraordinary effort or flexibility. It's a simple adjustment that yields significant results. This means any man, regardless of age or fitness level, can perform it. And the feeling of being able to give your partner this pleasure boosts your self-confidence incredibly. Practically speaking, all you need is a firm pillow. Place it under your wife's hips so that her pelvis is raised off the level of the bed. The mistake most men make is placing the pillow under her back instead of her hips. The goal is to raise her pelvis, not her back. Experiment with different angles until you find the perfect position. Abu Yasser, 63 years old, laughed when I told him about this position and said, "Doctor, a pillow? Are you joking?" 2 months later, he sent me a message saying, "I apologize for my suspicion. My wife asked me where I learned this. This simple piece of information changed our relationship." So here's a simple plan of action. First, start with the easiest position, the pillow position, as it doesn't require any major changes, just one pillow and a slight adjustment. Second, focus on communicating with your partner. Ask her how she feels and what she prefers. Communication is key. Third, don't expect immediate results the first time. Give yourselves time to experiment and learn. The goal is to enjoy the journey, not just reach the destination. That's all there is to it. 3 simple steps that can transform your sex life in just a few weeks. I want you to know something important. If you feel frustrated, embarrassed, or even ashamed about this topic, you are not alone and you are not broken. Your body simply needs support and the right knowledge. Even after 60 or 70, you are capable of a fulfilling, enjoyable, and connected intimate life. It's never too late. If this video gave you helpful information or renewed hope, please give it a like so it reaches other men who need it. Let me know in the comments which position you'd try first. Share this video with a friend or brother who might find it useful. And subscribe to the channel so you don't miss my weekly tips for men's health after 50. You could be the reason another man regains his confidence and happiness. I'm Dr. Mariana, and I'd like to remind you that after 50, vitality isn't lost. It's just waiting to be awakened. Take care of yourselves, and I'll see you in the next video. Remove these words.